Is our daily coronavirus update from the town of Bellingham. As I stated before, and will subsequent shows, this is an effort to keep the residents of Bellingham updated with the most recent and accurate information. As always, we're going to start off with Deputy Chief Mark Poirier.
Good morning. Thank you all for attending. Massachusetts numbers for cases: 13,837 cases in Mass. 260 have died. More than 1,300 new cases within 24 hours. So we are definitely peaking at this time. U.S. cases, over 245,000 cases are reported and almost 6,000 deaths. The governor has actually officially opened up a rapid response testing site in Lowell. I believe that's a appointment only testing site, so just follow the directions accordingly. We are still pushing, as well as the governor, to stay at home, and also asking everyone to wear a mask when they walk outside. Doesn't have to be a surgical mask. It can be a bandana or some makeshift type of mask that will cover your face and nose. This is a not mandatory, but it is an advisory. And that's it for now.
Our public health nurse, Esther, you want to give us an update locally?
Good morning. As of this morning, we had one new case come in overnight, so we are up to 22 confirmed cases in the town of Bellingham. We've had a total of 119 residents tested to date, and we have a total of 7 cases that have since recovered from the coronavirus. I received a couple of questions, actually one question off air that I just wanted to address regarding takeout. If you are getting food from a restaurant, either via takeout or delivery, the restaurants are following very strict guidelines in regards to hand washing, disinfecting, and limited touch of the containers that you are receiving. It is advised that you do wash your hands before you eat and after you eat, but that's just for good hygiene as well as to limit any exposure. But the restaurants are taking very serious precautions to safeguard you when you do take out food or have food delivered. And that's all for now.
Thank you very much, Esther. Bruce, Board of Health?
Let's see, kind of take it back here. I was set back on my heels from this morning's meeting. Continue, the stay-at-home that the Governor Baker has. It's very important. We're at the crucial high point. It's going to spread like wildfire if these people don't stay separated. Go out only for minimal, whatever it is you need for supplies or medical. But please remain at home. Stay safe. If you do go out, like Mark said, put on a mask or a T-shirt or a bandana or something. Avoid any types of congregating. We really need to make this effort for the next few days here so we can get past that. The disease is spread through social contact and any contact surfaces that you may touch or they may touch. So it's crucial. We've been working very closely with all of the different stores to try to maintain social distancing. We'll let our guests here to expand and elaborate on what they're doing to protect us. But this is very crucial time.
Thank you, Bruce. Dennis, you want to go to the floors first, or?
Why don't we do this?
So we are joined for today's meeting with some guests here from Home Depot and Walmart to kind of discuss what their practices are, what they're doing to prevent the spread of coronavirus, and also what requests they may have of folks visiting the stores. So we'll start off with Becky from Walmart. You want to kind of just give us an update with what's going on there?
Good morning, everybody. In our Walmart, we're following the company directives of social distancing of customers and associates. We have floor decals on the floor just to remind customers. Sometimes they come in and the stores are adding kind of a normalcy to people when they're coming in, so they're kind of familiar with the surroundings. So sometimes they have a lapse in memory of that. And those floor decals are just that reminder that, hey, you know, we really need to practice social distancing. We also put up sneeze guards on all our registers, and we're going to be putting them on our outlying registers as well as our service desk and at the pharmacy. That's still a work in progress, but the registers do have the sneeze guards at this time. We've also implemented a shopping cart washing regime. So we have new sprayers, and we have 55-gallon buckets of Purell that we are washing any touch surfaces from customers. And those are, every time they're brought in, we do a whole row of carts. So it's not just once a day, it's every time they're brought into the store, so that the customers can assure that once they're getting a cart, it has been sanitized. We have the senior shopping hour for anybody that has a low immune system, and that's from 6 to 7 every single day of the week. Our hours of operation have been shortened so that we can provide better stocking and better cleaning of our stores. And also we have been metering people into the store. We found that this weekend we kind of hit it a max. The company directive for us, we have a maximum capacity in our store of 3,100 people. The company directive is to have no more than 580. And we felt that 580 people was a little too much, because the areas that the customers are really shopping in hard are our consumable areas, which is our food, our health and beauty aids, pharmacy, and paper and chem, obviously. So we felt that 250, 275 was really our max, so that we had people that were no less than 6 feet apart, and just so that they didn't have to pass each other to get the items that they were looking for. So at this time, it looks like our having people metering into the store and the corrals. We have one entrance in, and then we have one out, so that we know exactly who's in the building at all times. So that's kind of the place that we're in right now. Thank
Great.
you.
Thank you very much.
Question.
Yeah.
Becky, thanks so much for joining us today. Just a few
My
questions.
pleasure.
How are you finding the lines forming outside the store when you're restricting the number of people that are going in? How are you managing that?
We have associates outside. Just remind, we do have signs out there that request that they are social distancing 6 feet apart. We also have an associate out there that is metering the lines and just reminding them gently, you know, please stay 6 feet apart. It hasn't been, I haven't seen lines out to the parking lot or around the building or anything like that. Probably 10 people max in line waiting to get in. We usually have 10 people going out, 10 people coming in, so it's kind of controlled. This weekend was really the first time that we have had that kind of metering, but during this week, today and yesterday, we really didn't have 250 people in the building at any one time. So it hasn't been an issue, but we do have somebody counting, and we do have somebody outside when we do have lines.
Excellent. How are you finding the hoarding situation with, has that slowed down? The grocery stores we had on last week said that has slowed down a bit, where people were going in and wiping out all the paper products and cleaning supplies. Is that slowing down at Walmart as well, or you're still?
I think it's a customer mindset now. They kind of know that it's one. They try to stretch the limits, so they try to get one of Angel Soft and then one of Charmin. But you know, we've had to let them know, hey, we're not getting every brand every day. We're getting a pallet of this or a pallet of that. So it might be Scott's today, it might be Angel Soft tomorrow. So we're limited to one per day per customer, no matter what the size is, unfortunately. And I think that that's across the board. We don't really have too much pushback anymore. But there are an occasional customer that wants to, you know, bring 3 people in from their family and buy 1 each. So we try to make sure that the group gets one family, 1 thing of toilet paper or paper towels, hand sanitizers, sprays, any kind of disinfectant sprays, or any kind of wipes. So unfortunately, that's the position we're at, because the manufacturers are just not keeping up with the demand right now.
One of the questions that we have, we get emails in, and one of the questions was, what measures are you taking to protect your employees? People are all concerned about the employees in the grocery stores and shops like yours that remain open.
And I really appreciate that. We have absolutely stressed social distancing from each other. We provide them with 2 masks a day. It isn't mandated that they have to wear them. We suggest it and we give them to them. We provide them with gloves, and we've also provided them with personal hand sanitizer, as well as any hand sanitizer up at the service desk area, the desk areas such as the customer service desk, at each one of the registers and at the outlying registers in electronics and such as that. So we are trying to protect our associates. And if we also told them we have a very lenient attendance policy at this point, even if they feel the least bit sick, whatever it is, a scratchy throat, a headache, or whatever, we want them to stay home. And we've told them we want them to stay home. We want them to take care of themselves, and we want them to take care of each other.
Thank you.
All right. Next, we have representatives from the Home Depot. So it looks like Kristen and Matt. You want to kind of give us an update again, kind of policies, procedures you have in place, and anything that you would request from residents when they visit your store.
Good morning. Yes. So much like Walmart, we are also limiting our customer traffic. We are limiting this to 100 customers at a time in our building. The company states that we can go up to 150. In this particular building, we felt that 150 was a bit too much with, again, where the customers are shopping. So we have limited that to 100 in our building. We have 1 entrance in as well and 1 entrance out. We have a line outside with social distancing markers on the ground. So if there are people waiting, we are requesting that they're standing that far apart. We have markers across our store, be it the service desk, the paint department, keeping folks away from these areas so they are not so close to our associates or to each other, and social distancing marks throughout the floor in the store as well. We have gone to curbside pickup for any type of online orders. Our customers are able to come into the parking lot. We have dedicated 10 spots for any online orders. They can give us a call, so that way they don't need to come into the building. We will run it out to them. It's touchless delivery. We will put it in their trunk for them, and there's no reason for them to even sign anything. This way they can get on their way as well. But much like Walmart, we're doing the same type of things. The sanitizing, all of the carts. Our shopping hours have been decreased to 6 p.m. every day, Monday through Sunday. Monday through Saturday, we still open at 6 a.m. and on Sundays we open at 7 a.m.
I got a question, general question for both the stores. Do you guys have in place any kind of special returns policy due to COVID? If so, is it posted throughout the store and to make sure people are aware of it?
So speaking for Home Depot, at this point, we do not have any limitations on returns. The thought being, obviously, if our customers are in need of money and during this time, we would like to make sure that we get their money to them. So we are not limiting any type of returns. Our associates that are manning the service desk in the returns area are wearing gloves if they feel that they need to, and the same thing with masks as well. But we are not limiting returns at this time.
Okay, great. How about Walmart?
Returns, anything bought during this time period for clothing, bedding, and any kind of fabric type things at this time.
Okay, we missed the first part of that. It is limited or it's not?
It is.
Okay.
Those items are limited. We do have signage up throughout apparel. We have the fitting room closed as well. And I did want to mention, we do have the availability of curbside pickup in both pharmacy and in pickup today. So anything you order online, we have curbside pickup available.
All right, fantastic. Any other questions?
Just, is there a minimum purchase on the curbside?
No, there's no minimum purchase on curbside.
Thank you.
All right. Thank you very much, Home Depot and Walmart, for reaching out and agreeing to come in to kind of keep the residents informed. Much appreciated of your time and appreciate what you guys are doing for us. So thank you very much.
Thank you.
At this time.
Can I have a quick question with, so both Walmart and Home Depot, during this time where you have one entrance and one egress, we're just, as the fire department, we're just making sure that all emergency exits are kept open at all times. I understand that you're managing the amount of people that come in, and I applaud that during this time. But we also need to make sure that all the egresses are available to anybody that's inside the store. So that's just it. I understand we've had some complaints, and we've investigated, and everybody's following the rules. I just want to bring that up again, just so everyone knows that their safety is still number one.
Absolutely.
Thank you.
All
Absolutely.
right, great. Thank you very much for helping out.
Thank you.
Sure, I just had actually, we might as well do a couple of questions that we have. We got a question for Esther, our public health nurse for the town, and someone's asking, is there an effective way to disinfect paper money, Esther?
So money is actually not made out of paper. It is made out of a fabric. There really is no known way to disinfect it unless you're spraying it with Lysol. It is also not known how long the virus can stay on the fabric that money is made out of at this time.
Okay. So use your debit card whenever possible.
Yeah.
That would be my recommendation. Yes, use your debit card, sanitize your debit card, use Q-tips to punch the numbers on the ATM, the machines, or use sanitizer or gloves before you're pushing any of the buttons. But yes, it is recommended that you use some card form of payment at this time.
Esther, another one for you. Is there any evidence that coronavirus could be spread by mosquitoes?
There is no evidence that the coronavirus can be spread by mosquitoes at this time.
So that's a bit of good news.
Yes, that is definitely good news.
Thank you. Just a couple of other updates for the public. Norfolk County Mosquito Control will begin their aerial spraying in the weeks ahead, this week and next. So if you hear those planes flying overhead or the helicopters, you know what that is. They are going to make an effort to stay away from residential areas to the extent that they can. Typically, they get those wetlands close to some of the neighborhoods, but they're concerned that it may elevate tension or anxiety that's already out there. But they will be out spraying, and before you know it, we'll be talking about Triple E again. So that'll be starting soon.
The good old days.
We've been notified by our trash hauler that bulky item collection, the items that you can put curbside along with your toters, will discontinue temporarily effective tomorrow. So if you have bulky items, please don't put them curbside. Keep them in your garage or the side of your house until after this event ends, and we'll work with you. I know some households put a bulky item out every few weeks, but we'll figure something out once this ends. But the idea is to keep the drivers safe and in their trucks so we don't have a disruption in our collection of solid waste and recycling. So the bulky items, we'll be putting a code red out. We've already put it on the website to let people know no bulky item pickups beginning tomorrow. And we have been rebroadcasting. So these episodes have been, obviously we're broadcasting live to the public, but we've been rebroadcasting throughout the day. So thanks to Access, local cable access, for putting those rebroadcasts out.
Dennis, just on the question and answer portion, there was a question that came through the town planners in regards to gas stations. I guess it came towards me. Are there any codes or anything issued in regards to pumping gas as far as touching the handles? So right now, we have not received anything in the fire department regarding that, but it's also good common practice that after you use the gas pump to fill up your vehicle, you should wash your hands. Most gas stations I see have the sanitizer at the gas pumps. You utilize that before getting back in your vehicle. So still good hand sanitizing practices will go a long way.
Anyone have anything else? All right.
You know, one thing maybe we could flash over, Mary, can we flash over to our daily board? We are keeping tracking. If you look at our board, it shows on April 3rd, we had 14 positive cases. On the 5th, 19 cases. On April 6th, we were up to 21 cases. Today, April 7th, it says 21, but it's actually 22. We just got the latest update from our public health nurse Esther a short time ago. So we're up to 22 cases today. And those are the ones that have been reported positive. Undoubtedly, there are people out there that may be asymptomatic, and it just really strengthens the need for social distancing and doing all the things that we talk about every day. But obviously, the virus is in our community, and it's in the communities around us.
Dennis, one thing, those numbers only reflect Bellingham residents. There are people that are working in Bellingham that have been tested positive, but they're reporting to their public health nurse in the town they live in. I know of 3 other cases that have been recently brought to my attention, but they aren't Bellingham residents. Thanks.
Well, that concludes the April 7th update. We will see everyone tomorrow at 10 a.m. Thank you.